So I'm Amanda Chu, and I get the honor to talk with and listen to Michelle Minickel here today. She's a family practice physician at Bellin, and she'll be sharing with us a conversation about the biological basis for resilience. So please, Michelle.
Thank you. So at the very first steam engine talk ever, I presented on chronic stress and the physiologic effects that it has on the body. So as a brief review, chronic stress is created during ongoing stressful situations. It might be something like a mean boss, family problems, health issues, or even maybe a pandemic. Ultimately, what creates stress in the body is oftentimes a lack of control over a situation. And keep in mind that the biggest drivers of chronic stress are probably violence, poverty, and discrimination. So stress can enter the body both consciously and subconsciously. And this causes a cascade of signaling molecules with fun names like interleukin-6, interleukin-2, interferon, and molecules like epinephrine and norepinephrine. These go on to affect some hormone levels, particularly cortisol, which has the ability to actually alter metabolism and increase glucose levels. All of these signaling molecules also will combine with cortisol to increase blood pressure, increase plaque buildup in our arteries, and even increase the clotting of our platelets, all of which leads to an increased risk of heart attack and stroke. It's these same chemicals that are thought to also affect the brain and increase the risk of mental health, like anxiety, depression, and drug abuse. They can also alter our immune response, causing some people to have an increased susceptibility to infection and cancer, and other people to develop autoimmune conditions. And they also even increase pain. But what we're going to talk about today is actually resilience, or the factors that can help protect your body from these effects of chronic stress. Resilience has a lot of definitions, but I like to think about it as adapting well in bad situations. We've learned from research that organisms that show resilient features probably produce less of these hormones and chemicals that come from stress signals, and they also respond less to those chemicals when they're produced in the body. So let's get to it. This pandemic has been stressful. We all want to know how to be that resilient person. So first of all, you want to try to avoid childhood adversity. This includes things like the death of a parent or a sibling, exposure to poverty, violence, or significantly unstable housing situations. This appears to be quite important in developing resilience. But let's face it, we really can't go back and change our childhood, nor do we have any control over those situations as they are occurring. So the good news is there's lots of other ways that we can boost our resilience. Some of the things that have been shown to support resilience on a biochemical basis include using active coping methods. So things like facing your fears and eliminating denial as a coping method. Being socially connected and harnessing social support appears to be really critically important as well. They've also done studies looking at generosity, and kids, even those who've had adverse childhood experiences, when given the opportunity to be generous and give a gift to another, actually have decreased production of cortisol. Spirituality and optimism also appear to play key roles in some of these hormone signaling responses within the body. This list is by all means not comprehensive. There are lots of other things that people can do that build resilience, and that's certainly very individual. And I also want to state that it's plenty easy for me to throw this list up here, but achieving these things, particularly during a pandemic or during other significantly stressful situations, can be really hard. So the other thing that we really need to address is epigenetics and the influence of that on the stress response. Epigenetics is the process of turning on and off our genes based on different environmental exposures or behaviors. So we can't control the genes that we have, but we're learning through more and more research that we have the ability to actually activate or deactivate a lot of them. It's a pretty interesting research area right now. And some of the big things that have been shown to affect our stress response through epigenetics are healthy eating, exercise, and not smoking or using drugs. So I'm sorry, I'm not really offering anything new here. We've been talking about these same things for like decades. So I apologize to not have anything new in this realm, but at least now we're finally starting to understand some of the reasons behind the long-term responses to these different activities and why they help us. It's even been shown that mothers can turn on and off some of the genes of their fetus as they're in utero. That can then also indicate, or it can also affect how the fetus will respond to stress during its lifetime. For those of you who are wondering if there's just a pill that you can take to try to tamp down the stress response, researchers are looking at both vasopressin and oxytocin as something that can modulate the response to chronic stress, but don't hold your breath on those two. It's not good to hold your breath for resilience anyway. So as stressful as this pandemic has been, I would encourage everybody to reflect on things that they have maybe done in the past year that might have actually boosted their resilience. Maybe things like not commuting for 45 minutes each way to your job. Maybe getting outside more, going for that walk, cooking at home, or maybe just calling your best friend every week to check in has been really beneficial for you in this pandemic. And we've probably done a lot without even recognizing it. So I encourage everybody to reflect on that and see what has been helpful for their resilience. And for those who haven't had a tremendous increase in stress with this pandemic, I encourage you to boost your resilience even more by looking at generosity. Because there's a lot of people out there right now who probably don't have enough to eat, who have maybe lost their jobs or are on the verge of losing their house, or who don't have a best friend that checks in every week. And I also want to close that despite being asked to give the talk on resilience, I also just have to throw out there that, we can have all the resilient coping methods in the world, and you really can't undo the effects of violence, poverty, and racism or discrimination. So that's really where the heart of the work needs to be, is in addressing those issues. So, thank you.
Thank you. Thank you so much, Michelle. And being around for that very first team mention that you were at, and just kind of this touch up today, because I remember last time you kind of took us through a breathing exercise and had us kind of bring this awareness into our body in the moment, and connecting that now through a pandemic and kind of reflecting on what we can do to be resilient is totally fascinating. Okay, so as a family doctor, you're working with a lot of people who are facing really big chronic stressors in life. You've named them. And with some other groups who have been the hardest hit by COVID. So what has this past year just been like for you?
Yeah, this past year has definitely been really challenging professionally for me. At the beginning of the pandemic, we really didn't know how risky it was going to be working. It was really the first time that I felt like I might be risking my personal health to do my career. And I had never experienced that before, and that was really challenging. And then right early on, from the very first week of April, I think, the patients at our clinic started coming down with COVID, and very quickly and in very high numbers. We actually had higher rates of COVID infection within Brown County than we did among any other city in the US at that time other than New York City. And a lot of people aren't aware of that fact. But at our clinic, we see a lot of patients that work at the 3 main meatpacking plants in town. And there are conditions that are just ripe for the spread of infectious disease in those meatpacking plants. They were also not using a lot of precautions at that time, and there were even monetary rewards to keep people working and not calling in sick during that time. So we watched this spread just rampantly through the Hispanic community in Green Bay, and that was really hard to watch. We felt like we didn't have a lot of control over it, and there were a lot of really tragic cases that came about through that. So that was hard. And then eventually things sort of slowed down, and we gained the understanding that we could practice safely and we weren't risking our lives every day to go to work, particularly through masking. And so things started to improve at that point. But come midsummer, I just felt terrible. And I realized that that chronic stress had really built up for a long time. So I had a lot of work to do in my resilience building. And so I've been doing some of that work, and there's still a lot more to go.
So that work that you're doing is kind of that work that you're sharing with us today, those basic kind of things, like that healthy eating and.
Yeah, and a lot of that stuff was sort of already in place for me. So for me, it was a bit more of the staying socially connected, because I think I had let that go by the wayside a little bit, just due to focus on the tasks at hand and bringing some more mindfulness and stuff to my career.
You had mentioned that before, just in a past conversation, that because we've been saying social distancing, but like trying to flip that term to physical distancing, because that social connection being so important for our resilience, our happiness, and all of that. So in what I'm hearing, COVID has directly caused hundreds of thousands of deaths, and it's also increased the overall death rate substantially. So what do you make of all of the non-COVID related deaths?
Yeah. So initially, I was concerned that this was maybe just the effects of chronic stress. And then I did some more digging more recently, and you actually see that the increased death rate parallels the death from COVID almost exactly by locality. So when we see the spike in New York City with COVID deaths is the exact same time we see the spike in non-COVID related deaths, which actually makes me think that it has less to do with chronic stress and much more to do with underdiagnosis, meaning we have tests that come up falsely negative, or a person dies before they can even be tested, even though it is from COVID. Or simply because the hospital systems have been so overwhelmed in different parts of the country that people who present with other issues are maybe presenting later or not getting as intensive care as they otherwise would have received. So I actually think it's probably more logistical than having to do with chronic stress. But certainly, I mean, I think that chronic stress has probably led to some degree of illness and possibly even mortality that is hard to really prove ultimately.
And so much that we're not going to understand until we're looking in the rearview mirror and kind of trying to pick up the pieces and understand what happened to us when we're thinking about community health. So you've spoken to these huge disparities by race in COVID fatalities, and with people of color having 2 to 4 times a higher death rate than those of white people, and that's all according to the CDC. Mm-hmm. Do you think this has to do with resilience?
So we certainly see that the certain underlying health issues will increase your risk of death from COVID. So namely diabetes, hypertension, obesity, these illnesses will really increase your risk of death from COVID. And a lot of those illnesses are certainly tied to chronic stress. They are more likely in people who have had significant adverse childhood experiences or have prolonged chronic stress through adulthood. And so I'm concerned that chronic stress would contribute significantly to a person's overall health picture and their ability to survive in COVID. And we also know that chronic stress can affect the immune system. But research is showing more and more over these past few months that the increased death rate among patients of color really probably has mostly to do with their exposure risk in the United States. So once a person is sick with COVID, they actually have a similar mortality rate regardless of their race. But the problem is that patients of color in this country were exposed at such higher rates because of their places of employment, because of the transportation that they might use, because of the housing situations that they're in. So that the mortality rates that we're seeing right now are actually just directly reflective of their risk of acquiring the infection in the first place.
Okay, thank you. And that, it's like, so some of those things you're talking about, this higher exposure, and that lends me to think about the systems in place and the structures in place that are creating those circumstances. So you've talked about what we need to do as individuals to boost our resilience. What do you think we need to do at that systems level to boost and reinforce resilience for a community?
Yeah. So I think that there's a lot that can be done there. I would love to see some more thought around increasing social connectedness on a society level. I think there's a lot that can be done just in terms of structuring neighborhoods, funding of community programs, structuring of apartment buildings even, in ways that can help bring people together and improve that socially connectedness. I also think that reducing stress from poverty is going to be very important, so I will support anything that can help improve economic equality between people in this country, as well as their access to quality healthcare and high quality education as kids. I'd also love to see more education on the effects of chronic stress and how to cope with that and how to build resilience in the school systems. I think I picture teenagers coming home and talking about the importance of generosity or what their moral compass is, and just think how great that would be if that could be a part of our curriculum. And then ultimately, we really need to target that, the underlying drivers of chronic stress, looking at racism and how we can dismantle some of that structural racism, looking at poverty and violence and what we can do there.
Thank you. That's making me recall at Washington Middle School, they, set up this meditation room and they had a mindfulness program, and this is all before pre-pandemic, and I think they had a couple years under their belt of developing that program, but over time to see what the impact is will be really interesting. Yeah. So more live questions. What's one thing about COVID that you think people don't realize?
Ooh, I guess maybe something that takes a little bit of time to think about and process would be some of the benefits that have come from COVID. And I definitely don't want to, make light of the tragedy that COVID has been. It has been just a tragedy of incredible proportions. And my heart goes out to all those who have lost loved ones. But I think it's probably also made a lot of us slow down in ways that we may not have been forced to slow down previously, and to really think about what is it in our lives that brings us joy? What are those things that we can't do without? And what are those things that we were just doing because everybody else was doing, or we were just going through those motions? So I do think that there's probably been a lot of people reflecting on that, and I think that can be one silver lining.
Thank you. It's giving ourselves permission to knowing that the impacts, like 500,000 people have lost their lives to COVID. It's heavy stuff, but giving ourselves permission to kind of feel a little bit lightened by whatever we can find to be the silver lining is maybe a part of that generosity that you're speaking of, like just being generous with ourselves. I appreciate that. So I'm looking, I'm trying to track more of these live questions. So what are some easy ways to bring down your stress? Being a college student, you're always stressed. So what is something to do for 5 minutes that would be easy to bring that stress down?
Ooh,
you just have 5 minutes.
The 5 minutes,
Golden
yes.
minutes.
So I love 2 to 3 minutes of breathing exercise. Breathing exercise in which you inhale for 4 seconds and exhale for 6 seconds. And you actually want to count it out with your fingers as you're doing this exercise, can really lower the heart rate and blood pressure, sort of stimulate that vagus nerve and this parasympathetic system to tamp down that flight or fright system that we have in play when we have chronic stress. So I would dedicate 2 to 3 minutes of a deep breathing exercise there. And then I would take an extra 2 minutes to sort of ask yourself, what is the reason behind me in college? What am I trying to accomplish? What is my goal? And how can I direct that stress towards being productive and meeting that goal? And what's the stress that's just building up from all of the other, pressures that I don't need?
That's great. And it's actually getting at another one of the questions that had come through about those breathing exercises that I mentioned last time. So anyone who missed that, and I don't know if actually we have a recording of that somewhere where we could pull that up again. It'd be fun to see what that talk was too, and kind of bring these together. So you're a physician, and what are some ways that others can maybe discuss just the very notion of resilience with their own healthcare providers? Would you recommend it, or is there a way to bring it up? Is my primary care person gonna know, like, oh yes, resilience?
Yeah, that's an interesting question. I will say that almost none of this was in my medical training, sadly, and I really see that as a deficiency in medical training. All of this is just out of my own personal interest in this topic. So I don't know. I think it would depend on your provider. I'm sure there's a ton of providers out there who are happy to discuss resilience and how to decrease stress. And maybe resilience wouldn't be the term to use, but maybe you'd want to say, I really feel like my stress level is getting to me. Can you help me develop relaxation techniques? Can we talk about how I can lower that stress level? And I'm sure every provider is going to have some advice for you in that realm.
So we don't have to say, like, if we looked at your other slide, like it's not like I have excess cortisol and my vasodilation
No
is
tests
outrageous.
are needed.
Okay. Okay.
All you need to do is say, I'm feeling stressed out.
Yeah, right. And just as more of us are, circling back with our healthcare providers coming out of the pandemic, it's nice to keep it on top of our mind, these lessons learned and these things that we've been able to look back at and reflect on, and how we can become more resilient, moving forward.
Right.
Thank you so much. Thank you for your time. Thank you for your thoughtfulness. And for 2 steam engines, steam engine 1, steam engine 14.
You're welcome. Happy to be a part of it. Thank you.
So if you have any more questions for Michelle, I'm sure you can keep throwing it in the chat. We can follow up with her. We'll make sure that we share that out because all of y'all are so thoughtful and you're coming up with great questions as we go along. So again, if you didn't hear from us before or hear us introduce Isabel Robertson before, we get another song from her. Thank you, Isabel.
When I look into your eyes, it's like watching the night sky or beautiful sunrise. Well, there's so much they hold, and just like the old stars, I see that you've come so far to be right where you are. How old is your soul? I won't give up on us, even if the skies get rough. I'm giving you all my love. I'm still looking up. And when you're needing your space to do some navigating, I'll be here patiently waiting to see what you find. 'Cause even the stars, they burn, and some even fall to the earth. We've got a lot to learn, and God knows we're worth it. I won't give up on us, even if the skies get rough. Giving you all my love, I'm still looking up. I won't give up on us, even if the skies get rough. I'm giving you all my love, I'm still looking up.